We are going to record today's session. So if you want to turn your camera off, change your name, that's fine. But we are just capturing Kate and the slides so that those that aren't able to attend today can actually catch up. We're doing a combined meeting of our workforce wellbeing and mental health special interest group members today. So that's really exciting. If you're new, welcome. We hope you enjoy today's event and continue to attend future sessions. I have the pleasure of introducing you to Dr. Kate Allatt, who is our speaker for today. Kate's on screen waving. Now, Kate is a young stroke advocate, inspirational resiliency speaker, and creator of our soon-to-launch IHSCM How to Build Resiliency short course masterclass. She is also Stroke Rehab Times columnist and GripAble Rehab ambassador. And today, Kate is leading a workshop for our members on how to lead wellbeing. And I'll hand straight over to Kate. Thank you so much for being here.
Thanks a lot, Jabe. I'm so excited to be here. So thank you for joining us on my session again, which is about how to lead wellbeing. So hopefully you'll find it really valuable, engaging. There's going to be, after I've stopped speaking, there'll be options for us all to chat and interact and talk and share ideas. So I hope you have a good time. So I'm here today to talk about how to lead wellbeing, and hopefully the learning outcomes you'll get from this session is, I'm hoping that I'll be inspiring and I'll deliver some compelling, compassionate storytelling. Also give you some practical examples of how to lead with wellbeing through compassion for service delivery improvements. And then discuss areas of how we embed that compassion in our organizations. And then finally, a toolkit to help you lead compassionately in your organization. That's what I'm trying to deliver today, and hopefully that's what you'll take away. But again, ask me anything you want, whenever. So we have a compassion crisis. There are over 100,000 vacancies in the NHS, I'm sure more. Costs of employee mental health have risen from 1,700 just over to just over 2,000. 51% of staff met criteria for probable mental health conditions. 36% of staff met the criteria for probable PTSD, and 18% of staff for alcohol misuse. Now, that's just a snapshot. There are much more figures and data you could look at here, but we have got a crisis, a huge crisis. And it's not just the cost of living and all the issues that are going on in the NHS at the moment. So I believe this is such an area that we can really make a difference to people and to our organisations. And I feel really passionate about it. Oops, hold on. Oh, the thing's gone off. So sorry about that. So what is compassion? Well, compassion is a sensitivity to the distress and of self and others, with a commitment to do something about it. It's about protecting, providing, and motivating people. It's about comforting, soothing, and validating. Let's see if it has worked. But why listen to me? Who am I? You know, I've written this course or this session, but I've written it from a personal point of view, because 13 years ago, I was running my own marketing business. I've got 3 young kids, aged 4, 8, and 10. And I used to run 70 miles a week. 12 hours earlier, I was running around Chatsworth Gardens. 12 hours later, this happened.
Kate Allatt from Dore in South Yorkshire had a severe brainstem stroke and then went on to develop locked-in syndrome. Doctors said she'd never walk or talk again, but the mother of 3 defied their predictions.
So it's pretty extreme. I had a brainstem stroke. The brainstem, as you'll know, controls everything. I was totally paralysed below the eyelids. Think buried alive, and you'll get a good idea how I felt. I was never vegetative, which doctors assumed I was. I was just unable to communicate. There was no signal because no one part of my body moved. And my eyelids didn't move for 2 weeks until after I emerged from the coma. So I relied on other people. I relied on people to communicate for me, to be compassionate, to keep me safe. It was a very vulnerable situation. In fact, probably the most extreme of situations.
Kate Allatt from Door in...
So, sorry. So in terms of my own experience, I also want to explain to you how compassionate care helped me be the person I am today. And I have to say, the one simple thing that takes no time, but it was hugely, hugely important to me, was the doctors and the nurses who troubled to look into my eyes to see whether I needed something. I couldn't communicate, I couldn't flinch, I couldn't twitch, I couldn't do anything to indicate that. But our eyes, the windows to our souls, and they would tell anybody who had the time to look, which really doesn't take much time, that there was an issue, I needed something. And I could try and eliminate things that I needed. But conversely, the nurses and the doctors on shift who looked at their papers, looked at their screens, their tablets, shuffled around my bed, talked over me to my relatives and my friends, never addressed me directly, even though it was me they were talking about, was very, very, very distressing. And for some, it would turn them off their whole patient recovery process. And I know that for a fact because I've subsequently gone on to help 700 odd people all around the world with locked-in syndrome be the best they can be. So as simple as looking into a patient's eyes or a colleague's eyes, just to see the non-verbal cues that they might be struggling, they might need extra support. It's really, really important looking to people's eyes, your colleagues. These guys here, Matt and Oliver, were the most compassionate carers. They were my nurses, and they took the time to explain to me what I needed to do in order to walk out of hospital, to hug my kids, to eat again. And they were like encyclopedia for me. But they didn't have to do that. That was incredible compassion. I was very driven and motivated to be back with my kids, and they gave me their time and their knowledge to equip me to be the best version of me. I mean, this is what I am. And I'm very grateful. And my neuropsychologist knew I loved running in the hills. As part of my rehab, she took the time to get noises from the Peak District to play for me so that I could feel close to my nature, close to my comfort areas, to help soothe me when my mental depression, I mean, it was hard working so hard, but those things really mattered. And it was really compassionate care, taking the time to get to know the person in front of her, the patient on the ward of 27. And this guy here, he had no idea how to help me run again. But you know what, within a year of my illness, me and him together ran again. And it blew everybody's minds, but it was something I was so driven to do. But he bought into what mattered to me and showed me extreme compassion. And look where I am because of that. And I think it's so valuable. And I think it's really important to explain this to you from my point of view, that I'm talking from experience. I think in the workplace settings, compassion with our colleagues is so important. And it really grows trust and builds a team and embeds compassion organisationally. And then just very quickly, when I went on to subsequently help other people all around the world, you know, it was my compassion that helped Christine, who'd been in the wheelchair with the orange thing on her leg, who had been locked in for 17 years with a headrest, because I took the time and the trouble to go visit her and help inspire her. My visit was like an unmotivated reward, if you like, that inspired her. Within 2 years of our meeting, she was able to stand and eat again the first time in 19 years. So it really, it's truly powerful compassion if done properly. So how do you lead with the compassion? And how, I think what we need to do in order to be able to do that, we need to be able to take an action. For example, support someone in distress, recognize staff, offer kindness, reassurance. Very simple. Have you asked your team what motivates them? This is the action. This is how we get to know the people we work with, so we can lead more compassionately and understand what their needs are. Do you monitor stress levels, for example, and take action? I mean, this is an example I've seen used quite a lot in organizations. It's just a snapshot. It's anonymous, which is really important because people don't want to really share how they feel if they want a job or a promotion. So it's just taking a measure. How are the teams feeling? Are they bored, comfortable, focused, stressed, overworked? And it gives people, it conversely gives people the feeling, not conversely, that actually my boss really does care how I feel. You know, and I think this is a really good, simple technique. Another way to lead with compassion is, do you ask your team members how they'd like to be recognised for any achievements? Maybe they've gone above and beyond to deliver service improvements. Maybe they've come up with extraordinary ideas and changed processes and procedures that have turned into savings or improving patient experience, for example. But how do you actually recognise your team for those achievements? Do we just expect those achievements? Do they go as read, or do we just acknowledge them the end of the year? It's an awards ceremony. I think we could do an awful lot more on that area. For example, we could take anonymous survey monkeys to see how team members would like to be recognised. I was working with a company only a couple of weeks ago, and they were all given spa days for a body of work that they'd done. And 3 of the guys at the spa at the company had said it was completely unmotivating because they didn't want to go to a spa day. They don't like spas. So it's about unpredicted rewards, maybe, that well, it is unpredicted rewards, but it's about finding out what really motivates people or what matters to people. Do you take time to know your team's unique strengths? I know we tend to maybe, you know, get browbeaten if we do things wrong, but, you know, conversely, do we really acknowledge and understand, get to know what people's strengths are? Do you as a leader share personal stuff with staff to encourage that trust and that bond and that openness that we need if we're to embed compassion organisationally? So then, if you look at the actions that you do, you can then start to see, well, do those actions lead into any impact? Do they have any impact? But you can measure those, because you could take snapshots of whether, as a result of your compassionate leadership, staff feel more secured, they seem more valued or more loyal to you, and you retain more staff. Do they feel more proud? Is there less absenteeism and sickness as a result of your compassionate leadership and taking more of an interest professionally? Do you have higher staff retention? Are people feeling more emotionally resilient? We all need to be resilient and agile at work. And has it led to improved patient care and patient experiences? We could measure these things. And has it led to earlier discharge for patients, for example, because maybe you've encouraged this idea that, you know, to help patients be their best selves in the community, maybe it's our job, our team's job, to signpost places where patients can get information to get the skills, knowledge and confidence to be the best they can out in the community. So there's lots of ways we can add value to both the team and to patients, and you can measure the results. Are there less follow-up appointments as a result of your changes in your leadership? So in practice, workplace compassion is listening, attending, understanding, and using your skills to help service users. That's what your team are there to do. It's not pity, you know, where we acknowledge people's suffering, like, oh, here's a cheese sandwich, I'll make you a cup of tea. It's not sympathy, showing that we care about someone's suffering. It's not even empathy that we say, and we let people feel that you feel and understand their suffering. It's that compassion. I mean, the difference here is you want to relieve somebody's suffering, whether it's a patient, whether it's a member of staff, your team player. And I want to give you this example before we really open this up and have a good chat. Is I actually do really believe genuinely that compassionate leadership improves service delivery. And I'm going to use this example of a lady I only visited in the Northwest 2 months ago. Her name's Christine. Now, sadly, Christine had locked-in syndrome 18 months ago. And due to lockdown, COVID and everything else and lack of funding, her care has been, her therapy has been pulled back because there aren't the staff to deliver the therapy she needs, the occupational therapy, the SLT, the physiotherapy, and even the psychological therapy, which is so vital. And so what had happened, Christine had become very unwilling and uncooperative and actually grumpy and difficult in terms of the carers, in terms of the neuro institution that she is in the Northwest, actually. And but actually, when I took the time to visit her, she didn't know I was going there. So I was an unpredicted reward, if you like, that surprised her. And being face to face with someone with locked-in syndrome, you can imagine how extraordinary that will be to anybody. And she texted on her eye gaze machine this, and it was really profound for me. Sometime when my personal care I hurt makes me cry. This was the reason Christine was uncooperative. Lots of bank staff coming in, her therapy's been cut, all her passive therapy had been cut. She's lying, not moving for days on end. Her actually physically hurts to have her Inco pad or any personal care done. And that's why she was angry and aggressive and uncooperative. But no one had taken the time to actually ask her on her eye gaze machine how and why she was feeling the way she was. So I did. And as a result of that, there's her lovely family there who brought me over. She not only improved, she was able to communicate. We went to the CCG. They were paying for therapy she wasn't receiving. So that was pulled back. And now she's preparing to leave that neuro centre to use the funding to have funding at home for her therapy. She's so motivated. She's already improved so much. She's able to stand, do all sorts, even to losing a tracheotomy. And that's the power of somebody who's you've shown some compassion to, and she's gone on to improve, and she's actually going to keep improving, I truly believe, because she was shown some compassion. So it is really, I mean, that's an example that's related to my other work, my other hat, but it's just so valuable. People can be the best they can be if we are just a bit more compassionate. So my reflective questions, and I just really want to have a chat with everybody here, is, you know, with 61% of trust having increased absence and sickness due to mental health, and trust struggling, that staff are struggling to afford to come to work, which is having a severe impact on services and patient experiences. My questions are these. Well, there's two. What gets in the way of delivering compassionate leadership? I know the obvious ones, but I remind you, you know, looking into someone's eyes, just to understand the non-verbal cues, doesn't really take any time. So I know time will be the top one, and I know it's extraordinarily tough out there. I absolutely know that. But I just wondered whether we could have a little discussion on what really gets in the way of delivering compassionate leadership. Anybody? Hello. Does anybody want to come in?
This is an opportunity. This is an opportunity for everybody to participate in these questions. Please feel free to unmute. This is the participation section of the workshop. I can see Charity's unmuted. Please feel free to speak, Charity.
Lovely to meet you.
Hi, my voice is cracked.
No.
Kate, I was just listening to what you were saying about the lady who had a tracheotomy that has been discharged. That was very good, and it's a very passionate way to show your leadership that can improve someone's care. So that is very good. That is what we are looking at, making life easy for people who live in the community. So I'm up for it. This is what we do.
Yeah, I'm really grateful for your contribution. I think, it's absolutely vital that as part of this cascading, with leaders and team players and clinicians with patients, is I honestly do believe we've got to do more to give patients the skills, knowledge and confidence to be their best versions in the community, to give them what they, the resources they need, or the access or the links to things they need to do to improve themselves. Because Chris, she has the most phenomenal drive, but with months and months of nothing happening because the trust can't recruit neurophysios, OTs, SLTs. They're getting their funding from the CCG, but she wasn't getting any of the therapy, so she's stagnated. She's a really good example, and what you've said, I totally agree with you. And I know there's some good work doing out there, but I think it's our role in anything we do is to give people the skills, confidence and knowledge to be their best versions.
Thank you, Charity. Ainsley has their hand up. Would you like to unmute?
Hello, yeah, thank you for that presentation. Really inspiring, I thought. And I was just giving a little bit more thought to your comments around things that might be barriers. And there was a few things, I guess, that came to mind that could get in the way. And those were sort of burnout and fatigue from staff being sort of emotionally drained, I guess.
Yep.
And then I wondered about as well, maybe lack of awareness sometimes about the impact of their actions or their behaviors and how that is affecting others and the relationships that they have with people they're working with. And maybe for some people as well, having a lack of space to reflect or have supervision regularly to think about these things in more detail. Certainly, I sometimes get the impression when everyone's rushing around just doing, what they can, they don't always pause to think about, how was that interaction? I wonder how that felt, those types of having the space, I guess.
And you know what? I thank you very much for that, Ainsley. I think it's really good. I think, it's so important. And I actually have some points that, if we discussed them or we didn't, that would come out on my talk. But having the time to reflect, is that, do you have the permission to have the time to reflect on, your actions? I think that's part of embedding the compassion leadership, I think, in the organization, giving people that time. If people are, so I absolutely, it's one of the points I suggest as well, that I think I'm not sure that people feel they have got the permission to take that time. And they haven't got the control, which I think is another area that needs addressing. People, we have a situation where I believe all of us are compassionate individuals, we just are, but we aspire here, and not all of us are able to live up to that. So where we want to be and where we are, there's a gap. And for me, that's a very interesting, in everything I do with all my training, this is the fundamental issue. It's like where we want to be, because no one doesn't want to be compassionate in anything they do, but where they actually are. And it's actually trying to unlock the barriers to that. What gets in the way of me being this person I want to be? So, and Boyantis, he came up with a model on intentional change, and it's really interesting, and it's something I strongly urge leadership to look at, because it tries to unpick that, because there is a gap. It's like, with everything we do, I read a lot of stuff about parenting. We get upset with our children, and the problem is our expectations are here and the kids' behavior is there, but we often expect too much from them. So we get upset and just, so it's a similar thing. So we all, it's actually really unpicking how we get to be more where we want to be.
There's some feedback in the chat as well, Kate. So Dave highlights poor leadership, as you've just explained, including stress, exhaustion, tension, all having an impact on being a compassionate leader. Then there's a comment from SA who talks about barriers from expectations of workforce, again, that you've just explained, but also being confined into policies and processes versus what people think compassion is.
Yeah, no, I think that's really, really helpful, really, really helpful. And but I think what I would want to do, I am the Ronseal kid, I guess. I do what I say on the tin. I'm a Marmite as well, so you either love me or hate me. But I do think that this burnout, fatigue, this lack of awareness, I think a lot of these things that we're saying, it's like, okay, we know them, we say them, but what do we do about them? What do we do? What can we do? What can we do to address burnout? As I say, I work with quite a lot of companies, and burnout's a big issue there. They'll have, I'll give you an example. They have a massive client deadline, huge project, huge installation, people working 12-hour days, and they do that for about 3 or 4 weeks or even longer. And at the end of it, it's like the contract's been delivered, the client's happy, but then they've got to unsift all those hundreds of emails they've not been looking at because they've been distracted, and they've completely burnt out. And I said to the company, you expect people to work X, Y, and Z and really push it up there to deliver, but what do you do? What do you do for them? How do we address the burnout? Do we say to the simple unpredicted reward, which we know are very motivating for anybody, whether it's a visit to Chris or a letter from the CEO or whatever it is, but what can we do for our staff in return for them giving their all to deliver us and our shareholders a project? I'm not sure we have enough discussions about that. Permission, it's about permission control. All right, you could permission to come in at midday the day after you've just delivered on a big project. It's permission to take a week off. I don't know, but I think we should be having more discussions about that, because we can't always help by the amount of work we do, but we can be more compassionate with staff when those deadlines are met or services are delivered. I strongly believe, and I personally think we should be doing more to value people in that way. Has anybody else got anything? Because what I did want to talk about is, we've talked a few about, I've alluded to a couple of bits, but what compassionate leadership ideas could result in service delivery improvements? Again, I tend to go in with this Ronseal approach to life that, I want practical. I don't want ethereal theory stuff. I want to know practically, what can I do to start changing the conversation, start changing the feel of the organization or the team? So I wondered, has any of you got any ideas, practical ideas, or any of the suggestions that you think could result in service delivery improvements for you guys? Anything you can do in terms of your compassionate leadership? Charity, are you coming back on?
Yes.
Hello.
Hello. Kate, what we tend to do here in our organization, we know that there is lots of workload pressures.
Yeah.
And stress. So what we tend to do, because those carers are going out there delivering this job also on compassionate ground, but they are in a rush. They want to meet their time. So what we have done is to give those people in the office, give them the time, allocate them time to go out and meet the service users and their family face to face, give them that support also. Look at areas that we can help to assist them. Because the carers are not, they are rushing, they are going out stressful, they are going from one client to another. There's no time at all for them to have this time with the service users to sit down and look at the areas to help them. So the office staff, we are allocating time for them to go out, make phone calls, reach out to them.
Can I just say, I think that is extraordinary, and I've not heard that before, and I applaud you for that big time.
Thank you.
No, well done you, because I think, you know, in every which way, if you have a circle here, your carers are going to feel support and must feel supported. Your patients must feel valued, as would your carers. I could just see this being, and I think from your office staff point of view, for them to see what the results are for what they do in terms of their office jobs, you know, to actually put it in perspective. I've been an inspirational speaker now on the conference circuit for the NHS for 13 years, and it's the bean counters, and no disrespect, the accountants or the staff who are so removed from the patient user that my talks have such a profound effect, because it really puts it in perspective, and the power of your office staff having that, I just think it's phenomenal. So I think always round, I think that's an amazing initiative, actually. So brilliant. Well done you.
Thank you.
Does anybody else? Come on, you're all being very quiet. I don't bite. Or put it in the chat. I don't mind. But you know, in terms of you know, ideas, that's a lovely, lovely practical idea. That's just so powerful that Charity said. You know, have you got any ideas? You know, I was on Twitter the other day, and you know, and there was a big Twitter chat on a hashtag about how exactly this they could improve compassionate leadership, taking practical steps, how they could improve the lives of people who worked in the NHS. And it was, and I'll show you some of the things that they suggested on this. It was a half-hour Twitter chat, and it was so powerful that you don't have to do big things. It's like, you know, Beresford, who was the Team Great Britain cyclist guy. It was all about marginal gains, just small adjustments, but those small adjustments can end up making a huge difference.
We've got some feedback in the chat for you, Kate, if you'd like me to read that to you.
Yeah. So my guys are great.
Sarah says that the culture of the organisation has to be right, and that's a summary of the other suggestions that come below. SA says, offering flexible, agile working options, promoting clinical and line management supervision, and allowing time for reflective practice is key. Listen to your team, establish sets of values, show empathy, encourage and stay positive, says Dave.
Yeah, no, absolutely. No, thank you very much for that feedback. You're absolutely right. It's got to be top down. And we can't be talking about compassionate leadership or agile businesses unless there's buy-in right at the top and it cascades down. But I do believe we can take steps within that as well. And I guess, the buy-in at the top, that's another issue for another SIG. But I think at the end of the day, you're absolutely right. But there are some things we can do, look at those non-verbal cues, have anonymous survey monkeys, anonymous jars, which, take a real snapshot of the mood and the burnout levels and the stress levels within the team. And then you know that you need to make some adjustments. And the other thing I was going to say as well is that, this is all about being resilient, a resilient team as well, and the resilient individuals. And I think it's worth saying here that, because it was put to me the other day and I thought, wow, that's really powerful. We can all do stuff ourselves to be more resilient, and you can actually learn it. But I also think the power of connections is truly extraordinary and will help teams deal with their burnout, I'm not telling you to suck eggs, deal with the burnout, deal with everything else. Because the example I wanted to share with you, which I just thought was brilliant, was, in Hollywood films, and in Hollywood films, and you'll always see, like, say Jurassic Park, you'll have all these crowds of people that are hysterical because there's some danger. But that isn't actually what happens when people are in adversity or they're having a tough time. They pull together. You take Ukraine, they haven't all driven around, waving their arms in the air. So what I'm saying here is, the point of the story is, people get true strength by leaning on each other. And maybe we should look more ways to improve the way we connect at work, the way we connect at work and outside of work. That's also really important. Sorry, I was just reading the thing from John.
Yeah, so we've got some feedback in the chat again. Joanne's organisation has a wellbeing event for staff every month. The managers do the organising, the catering, etc., so that they can do something fun, the staff, rather than have to organise. They even offer mental health support, and everything's done via a suggestion box. Now, John illustrates a point. What do we do if we don't have colleagues who are demonstrating compassionate leadership? How can we encourage them to do so?
Well, if I take you straight back into to my talk earlier on, and we talked about the action and the impact. The action is, looking into someone's eyes, asking someone how they are today. If I go back, and I think we can also encourage and motivate people who aren't particularly. So I'm just flicking through. Compassionate in their job with unpredicted rewards. I talk about this a lot. I talk about unpredicted rewards are really motivating. You wanting people to be more motivated and to be more compassionate. We don't have to pay someone extra money. We don't have to give them big bonuses, but we could do things that matter to them, that encourage them and motivate them to be more compassionate, to ask more questions, to support more people through distress, to offer kindness and reassurance. What else is on there? Oh, yeah, to monitor stress levels. That's something that could be easily done by a team player, to actually, be targeted once a month to take a snapshot of the team mood with that simple diagram. There are things we can do to encourage more people to think more compassionately and think and do more compassionately.
John, would you like to add to your question?
Yeah, I would. Kate, I'm enjoying this. Thank you. The dilemma I have is that I think we've made quite a lot of progress in respect of encouraging compassionate leadership across health and social care in recent years, but we have a significant number of people who've not been brought up with this as the means by which they lead people. And whenever I go and talk to our members, a lot of them get frustrated by people who work with them or for them who don't do this, and they're struggling to change them because these people have been brought up on this idea of tell, direct, instruct, intimidate, And then you load in things like a CQC inspection, or you load in things like waitlist targets, or you load in stuff like staff absenteeism, and the pressure grows on these people. And the only way they know to combat that is to do anything but being compassionate. And I'm just interested in your take on what's the antidote to that? How do we persuade people that that is not the way? Thank you.
Well, I think, you have got an issue in terms of people have been recruited years and years ago. And I think going forward, these values of compassionately, it's not just the 6 C's, it's the values of, what we're expecting from you and what you wanting you to bring as an employee. That I think you can start doing that more easily. I know there's a recruitment issue now, so there isn't a huge pool to deal with, but I think going forward, you could be looking for more of these values, employing the sort of people that demonstrate those, and we test for those in interviews. But at the moment, you're talking about a cohort of people who are traditionally, they haven't worked, they haven't demonstrated compassion, have they? So I think it's very hard, but I also think that it has to be done through training. It's got to be done through training. And I do think we could reward more compassionate behavior. And that's what I'm talking about, unpredicted rewards. I think, if there people are going to get something at the end of it for doing something, they tend to do more. And I don't think we have explored unpredicted rewards. Unpredicted rewards create a dopamine effect. They have a dopamine effect in the brain, and they motivate people to act and behave differently. I think that area is an area that needs to be explored, if I'm being honest. I can't give you a specific answer on this, John, but I do think there's a cultural issue. I think there's historical employment issues of people who aren't necessarily naturally demonstrating those compassionate skills. And I think we can train more, but there has to be a will to want to do that. Fundamentally, it has to be through training, doesn't it? With some motivation. And I think we have to work on motivation. It's key. And it's the same with with everything we do things. We've got to be motivated, and to be motivated, it's got to matter to us. I can't tell someone they've got to. I just think it comes down to training. It's got to matter.
Thank you.
Kate, I do also agree with you, what you have just said about training. Also, we need to empower staff. Things that matters in the organization, carry them along, let them bring their own initiatives. By working as a team, we will achieve more. That's what I want to do.
I think you're absolutely right, but this goes back to what we were saying: permission and control. We all know about Waggles and enterprise learning collaborations. Where we want people within our organisations to work under their own initiative to bring service delivery improvements. But my question is, and it was what I dealt with in my training course, was that's all well and good to promote, to say that we want our team to work on their own initiative to develop improvements. But how, going back to what I just said, I don't think we talk enough about how we reward staff for that. That isn't more money. We know there's no more money. And I keep saying, I don't want to be boring, it's unpredicted rewards. It's about how we can explore that to make people feel, well, it's actually worth my while going out of my way to be really have lots of initiative to deliver you service improvements. If there's the so what, why would I do that? What's the so what? I really do feel very strongly about this. I also feel very strongly that, charity, your initiative is phenomenal. It's brilliant. I think it's just really good. But
Thank you.
I'd be really interested to see how is that reported, not just to the team, not just to the organization, not just to the board, publicly. How do we shout about that? That's a really good initiative, because when we do, so I think it's about not only the enterprise learning collaborations, which you've come up with, it's not only that, it's about how do we reward and acknowledge the staff for doing that in a way that we can afford to do with unpredicted rewards. I think it's really important, because otherwise, why should I put myself out? Why should I bother looking into someone's eyes? Why should I acknowledge someone? Why should I give somebody permission to have some control to reflect on, I know, a session with a patient or a project, whatever it is. What's the so what? So what if I do that? What will happen? And I think we should value people more. And I've said this from the off, and I think it's a very simple thing, but I don't think we do it well enough.
You are absolutely right, Kate. Incentives matters, and the staff values it. People that works, for example, I am a domiciliary care agency, and I'm the registered manager. What we have created in our agency is empowering those carers. They have come from different areas of their training, and they have brought them along with them. We empower them to use it for the betterment of the agency. And doing that, we are giving them incentives. It is their agency, not just that I'm the registered manager, but it is their agency that when they go out, they will say, yes, I am part, I am a team for this agency. They are enriching the community, not just themselves, but the community.
You know what? The empowering, and I think it's the buzzword for me. I think that it's so important. I think people that I want to use it, and again, this is I can only use it from my experience. To know that you've made a difference, to know that you've had an impact is crucial. And this goes back to John, and I'm going to answer your question again, John, in that additionally, I think that by understanding more the difference we make in our day-to-day lives, whether they be professionally or personally, are extraordinarily powerful. To know that you've had a hand in someone eating again after 19 years of nil by mouth, or standing up, or someone saying a few words, or someone actually getting the therapy they needed so they're not in pain when they're having their nappy change, or the work we do professionally and everything we do. I think the secret here, you talk about, why should people do it, and how do we get more people to be more compassionate who default back to their sort of rather more carrot and stick approach to managing. I think, understanding the impact, and like with your initiatives, Charity, that would be so easy to communicate. Social media, in whatever way, however you communicate to your team and your organization, but it puts it in no uncertain terms why we're all here, why we're all doing this. And I think those messages should be so important. It's not just anecdotal sort of stuff, we just throw out. I think it requires a communication strategy. an impact communication strategy that I think, I'm sure there are them, but I think they could be improved.
Thank you.
Does anybody else have anything to ask? Because I'm really enjoying this. I like to talk, but I do like to listen. So has anybody got any comments? How you felt about the session? Any ideas? Any examples, like Charity, of compassionate care in your organisation that you'd like to share with us? I mean, love to hear.
Yeah, I don't mind sharing something. We have an initiative at Guy's and St Thomas's called the Show You Care Bids, and it's basically an opportunity to empower staff to have a voice and some control over the decisions made about where funding goes for staff health and wellbeing. So people can apply for up to £5,000 from a sort of allocated pot of funding for a health and wellbeing initiative that they think will really sort of benefit their own teams. And that's been really popular because it's kind of given control and a voice back to staff. So yes, there's a kind of overall wider offer that's not going to go anywhere, but actually, teams come to us with ideas during the funding period and say, we'd like to apply for funding because our team's been impacted in this particular way. Can we have funding for an away day, or can we have funding for specific reflective sessions or debriefs? Others have applied for better outdoor space so that they can actually be outdoors all year round because they know that will really benefit their well-being. It's been really, really varied, but it's given that bit of control and kind of empowerment to staff to make individual choices about what the money is spent on. And it's not a huge pot in comparison to the whole health and wellbeing offer that we have, but I think it's made a big difference to how people feel in terms of the decision making. So yeah, that's been a good one for us anyway.
That's really brilliant. No, thank you. And again, I mean, control and power, permission, and these are the buzzwords, aren't they? It's just, I think the central, people buy in if they control, have some sort of control over it, and you've just proved that. So it's a great initiative. I wonder whether that could be rolled out. Do you think other organisations could do that on here? Anybody?
I guess the one thing I would say from our perspective is we're very fortunate that that's charity funded. So I guess it does depend. You were saying earlier about funding and the limitations that come with that, and we're very lucky that does come through Guy's and St Thomas's charity. So,
but there are ways to take this Show You Care initiative. I mean, my background was marketing, so I'm always thinking creatively. Is that it could just be an anonymous survey monkey. Then ask the question. So there isn't a pot of money earned of it, but it might be that multiple people come back saying, show you care, and they have an idea, or they have an idea. It's repeated amongst quite a few of the team players, and there's enough interest for the organisation to say, well, actually, this year we perhaps look at doing something on this, and how can we help our staff do blah or this. So I actually think, although there isn't the pot of money that you've got with the charity, I think as an idea, that's a really good idea to canvass some opinions, and again to give people control without the promise of a big pot of money. I think there are ways of exploring this, actually. So that's a good idea. Is there anybody else? Have you found oh, my internet stuff. I hope you can hear me. Have people found this session useful or interesting, or how could I have improved this session? Just really, really interested to get any feedback from you, really, and any comments. Please let me know. while we're still here for a few more minutes.
What I will do for you, Kate, is I will send out a copy of today's recording along with some notes that I've made in the minutes for everybody that's attended and those that weren't able to join us this afternoon. I'll also include your contact details so people can get in touch with you directly if they want to pass any comments to you that aren't with us today that are catching back up on this recording. But I've also put a link to our How to Build Resiliency short course masterclass that you've created for the Institute as well into the chat box so that people can find out a little bit more about that course before it launches next week. I'll also include a link in the minutes. But what I'd really like to do is just thank you for your time today, Kate, and thank you for your perseverance and showing your compassion. It's evident that it's something that can be learned, and it should be something that you should be looking for at the recruitment process, as been highlighted in the chat today. I'm just seeing if anybody else has popped any more messages on whilst I've been talking. Just thanks for your inspirational story. I found the session really useful. They want to thank you. It's been very worthwhile. Makes you really think about working towards being a leader that's compassionate. I'm being reminded that compassion is a strength, not a weakness, as some employees would have you believe. So I think everybody today has found this session really useful. And I'd just like to hand back over to you for some final words. You have got a prompt at the end of your slides about a question that you should be asking yourself every day. And I'll leave that to you to share with everyone.
Yeah, I have. Let me just have gone back, haven't I? Just bear with me a sec. I've had a brain injury, so just give me a minute. Here we are. Oh, this is it, yeah. Let me just go through, because I got so carried away with our chats that I wanted just to give you this information as well. So we talked about enterprise learning and collaborations, or WAGGles. I mentioned about how you communicate those to the organisation and reward staff. I think that's a really important body of work for organisations. So how would people like to be rewarded? You don't want to spar if you're not into spa days, for example. Take a regular anonymous survey monkeys to help monitor staff mood and fatigue and burnout. I think we mentioned right from the start, obviously it's on my list, do we give people permission to reflect what they've done, what they've done in a project or clinical session, how they could have improved it, and how, if they did it well, can give them time to congratulate themselves on that as well. That's really important. Do the team feel like they have control? Do you look for non-verbal cues to keep an eye on the mood levels, the burnout, the stress, so on? And Twitter, and I forgot I've got these extra bits, I got carried away. Some of the things that the organisations ideas they came up with on there, and I just thought they were brilliant in terms of little bits, like I talked about Beresford and his marginal gains. You know, could we help people with subsidised meals? This was a great idea. For night staff, have their cars defrosted or defrost kits outside so people can get home very quickly after a night shift and not spend 10 minutes taking the ice off the cars. That would have mattered to some people on this Twitter thing. Increased mileage rates, subsidised parking, extra fleeces. We all know it's cold at the moment. Support staff more with the IT. Provide warm spaces. Provide affordable daycare, childcare on site. Pay staff overtime rates, not bank rates. Put expenses on payment cards. These to take some of the stresses that might be coming from the cost of living, the stresses that people bring to work that affects the way they do their jobs. These things are really important as well. And so at the end of each day, I think you ask yourself the question, how can I be more compassionate for my team today? To try and ground you on being compassionate every single day. To try and be more compassionate. And I want to leave you with this, because I think this is really important. You know, key performance indicators, we all know them. I think we should change the way we look at those, because I think it would help improve well-being organisationally, and therefore it would help you lead well-being more effectively. And that's this, dead simple. I'm going to leave this with you because this could be a whole different session. Hopefully it will. I don't think those key performance indicators should be targets, should be patient, well, not only patient experience, I think they should be that. But in addition to that, we should be asking ourselves as leaders, how do I keep people interested? How do I keep people informed? How can I keep my team involved? And how do I keep my people inspired? And I think if our leaders thought a little bit more like that, then we have an opportunity to actually embed compassionate leadership in our organisations. So I'm sorry, I forgot I had the slides, but listen, that's me done. I really hope you've all found it useful, and I'd love to see you again sometime. But feel free to email me if you've got any comments, queries, suggestions. I'm all ears. So thank you.
Thank you again so much, Kate. Thank you for everybody that's made today's session a priority. It's Friday. That's it for most of us. I hope you enjoy your weekends. I look forward to seeing you online at another one of our events soon, and perhaps at our workforce wellbeing or mental health special interest group meetings. I'll be in touch. Take care. Thank you again, Kate. Thanks, everyone. Goodbye.
Thank you. Bye.
Thank you.